Hi guys, I'm Dr. Alyssa, chiropractor here at Strengthen You, your fitness and therapy experts. So are you somebody who's been experiencing some elbow or forearm pain, particularly on the outside here? If so, you might be experiencing something called lateral epicondylitis, also known as tennis elbow. Typical symptoms that patients usually complain about are pain around the outside of the elbow. It usually feels like a dull, achy pain that goes into the forearm, weakened grip strength, and they are unable to pick up objects. What a lot of people don't know is that you can actually get tennis elbow even if you don't play the sport. So it's an overuse injury that causes tiny micro tears in the tendon that join the forearm muscles to the outside of the elbow. These muscles are mainly responsible for things such as extension of the wrist and extension of the fingers. So if you're someone whose job requires a lot of straightening and bending of the elbow or a lot of twisting and grasping, then you may be susceptible to this condition. There's a few ways to address this. So if you're in acute pain, what you can do is rest and apply ice to the area. What you want to do is use a 20-minute on-off protocol. So if you leave it on for 20 minutes, you want to leave it off again for 20 minutes as well. Once the pain subsides, you would go more into the stretching and the exercises, which I will show you now. The first stretch you want to do is a forearm extensor stretch. So what you're going to be doing for this is you're going to be bringing the arm forward, keeping the elbow straight, curling your fingers in, and bringing the wrist down. You can use your other hand to reinforce the stretch. You're going to want to hold this stretch for about 8 to 10 seconds and do about 10 reps each day. For the next 4 exercises, what you will need is a light dumbbell. So you're going to be holding it in your hand. Try and get somewhere where you can rest your forearm against a table or a desk. You're going to bring your arm out to the side with your wrist hanging over the desk. Hold the dumbbell in your wrist and you're just going to do a curl up. So for this exercise, you'll be doing 10 to 12 reps, 1 set twice a day. The next exercise is called pronation supination. So now with your dumbbell, you're going to be holding the bottom part and you're going to be twisting the wrist with palm facing up and then palm facing down. Again, do this 10 to 12 times, so 10 to 12 reps, 1 set twice a day. With the next exercise, wrist circles, you're going to continue to hold the dumbbell at the bottom, and this time just moving through the wrist's natural range of motion, really getting rotation in through the wrist. Again, do this 10 to 12 reps, 1 set twice a day. The last exercise is the I's, T's, and Y's with wrist extension at the very end. So again, you're going to be holding your dumbbell. You're going to be bringing the arms up with the elbow straight right in front of you. And then you're going to bring it to 45 degrees, extend the wrist, and then right to the side at 90 degrees and extend the wrist. For each one of these, you want to do 12 reps, 1 set, and twice a day as well. If your sport or your work does require a lot of bending and straightening of the elbow, then some preventative measures that you can take is to take frequent breaks, as well as stretching the forearm muscles as well. Again, my name is Dr. Alyssa, chiropractor here at Strengthen You, and now you're only one strategy away from crushing your fitness goals.